Hi everybody, thank you for joining us. I'm Larry Little. We begin this morning with a closer look at the rate of testing in Santa Clara County. As you can see on the map here behind me, we have ramped up testing locations from South County and Morgan Hill, Gilroy, all the way to North County. But still today, community members are experiencing issues when it comes to getting testing, and that should not be happening as we have expanded testing with our June 10th order. And my colleague Todd is here to talk about that June 10th order that expanded testing to make things a little bit easier for community members here in the county. So just talk a little bit about what that order did.
Absolutely. So diagnostic testing is very important to our community. It allows us to identify who is sick with COVID, who may be at the early stages of that, so that we can provide care for those people who have contracted the disease, as well as prevent a lot of deaths, which is we have been doing a great job of doing that as well. Unfortunately, we have lost a few individuals, and our hearts go out to those who have. On top of that, this order allowed for people who are experiencing symptoms, as well as those who have been exposed to somebody who is positive, but yet they may not be experiencing symptoms, as well as those individuals who are high risk. And who are high risk are those frontline workers, such as pharmacy techs, EMTs, EMS services, our firemen, our police officers, our grocery store workers, our restaurant employees, as well as people who are frequently riding public transportation, to get that test at no cost to themselves without question. So the order that came out on June 10th required that all healthcare facilities provide a diagnostic test at no cost to the person.
Yeah, Todd, and on June 10th, Dr. Marty actually did a press conference here, just kind of talking more about that, letting the community know that they can be tested, because that's the only way we're going to slow the spread of the virus is by more testing. Let's take a look at this video from June 10th here. Taking just
where we really have seen the numbers not coming up to meeting what we really feel is necessary
so that we can meet our goals is testing by our large healthcare systems. And that has occurred for a number of reasons. A lot of them are well-meaning. They want to do the testing. They've come up against a number of barriers, and these barriers are being worked on, such as testing kits and reagents, the chemicals that they use. However, it's just not happened. We just have not seen the numbers being generated by our large healthcare systems.
Are there any healthcare providers in particular that you think should be doing more? I remember at a recent meeting of the Board of Supervisors, I think Kaiser was identified, a couple of other local ones. Any that you would say really should be doing more at this point?
Well, in this order, we're basically saying all the healthcare providers. So without singling them out, yes, it's Kaiser, it's PAM, it's Stanford, and all the rest of the hospitals. As I say, the one organization that has really stepped up to do more than their share has been Valley Medical Center. And so the most of these numbers that we're seeing in our testing levels have come because of Valley Medical Center, which means that if Valley Medical Center can do it and find the reagents, then any of those other systems can do the same. And with the help of the state, they should be successful in maintaining a high level of testing.
And Todd, despite this order coming out on June 10th, we're still seeing some of the same issues where the rate of testing is not taking place fast enough. Some people being turned away. For example, I went to my healthcare provider online and tried to schedule testing for COVID-19. They sent me to a survey, and after I completed the survey, it was about 3 or 4 questions. It told me that I did not need testing. Because I did not have the symptoms. People are constantly contacting us. Here's one of the emails that we received on Facebook. Why are you telling people that work with the public to get tested once a month if they cannot get tested without jumping through hoops and driving out of their city to do it? So what do you say to people who are experiencing issues getting tested? Because we have testing all the way from South County to North County.
Yeah, and this is a common concern we get, especially with our phone calls and our emails, and especially with our social media that are coming in at a greater frequency now. People complaining about not being able to get tested. They're frontline workers, they're exposed to people, but they're not presenting symptoms. So they have hit a lot of barriers. And really what we tell these people is what we tell any business that's not in compliance, we tell any community member, that observes a business that is not in compliance with any of the orders, which is they do actually need to file a complaint with the district attorney's office. But personally, the best thing anybody can do is really strongly advocate for themselves, because nobody else is going to advocate for you. So really lean on them, really express that you have a great concern for your health, because you work at a grocery store, or you're in a kitchen all day. You should really make sure that your voice is strongly heard, especially with your provider, and if they're denying you too.
And we really appreciate when people contact us,
Absolutely.
email us, call us, because we don't know what's happening in the community unless community members are telling us. Let's take a look at the numbers here, just to see who is doing what when it comes to testing. You can see here, County of Santa Clara Health System is at the top of the list. We're doing more than a share. So far, 103,000 tests, and then right after that, some of the others. Just talk about network capacity versus the community here, and the testing rate that's happening.
Absolutely. So we obviously release our testing numbers daily. We're doing thousands and thousands of tests a month. And obviously the county serves over 2 million people. But we have healthcare providers in this county that serve well over half of that population. And they have the same access to resources and so forth that we do. So like Larry had so eloquently said, they're not keeping pace with our current system, which is causing it to overflow in a sense, where people are having to wait in lines or having to come back at a later date because they've reached the amount of, they've exceeded the amount of materials that they have for that testing site for that day, especially with our pop-ups. So it really expresses how critical it is for people to go to their provider to ensure that they get tested there as well.
Yeah, testing is a very important part of the solving the puzzle here and slowing the spread. Let's just, not to call anybody out, but let's just look at this this list here, and we see, Kaiser here. They have hundreds of thousands of people in their network, and when you look at the testing, it's very low. And then some of the others too, El Camino Health, they have a capacity to actually do more. And people want to be tested. They're contacting us, and they're saying they're having to stand in wait in long lines.
Absolutely.
Or be turned away. So just again, talk about what people should do if this happens, because it's happening a lot, and we're about 2 or 3 months into testing, and it's still happening.
Yeah, and COVID-19 is not going to go anywhere. People are going to need to be tested for a very long time. But again, people should really advocate for their health, and they should be contacting their provider, because the order actually stipulates by law that if you are experiencing symptoms, you can get tested. If you're not experiencing symptoms but have been exposed to someone who has COVID-19, you can get tested. If you're a high-risk person, like for example, those frontline workers, if you regularly take public transportation, you are allowed to get tested at your provider at no cost. So please contact your provider as well and ensure that you're getting tested. We hear it all the time from people in our community that they're hitting a lot of barriers. Please keep contacting your provider. They're required to provide that COVID-19 test for you if you meet those 3 categories.
And if you're having issues still, feel free to contact us here at the county. We will continue to look into it, as well as we offer free testing here, but you should be able to get this testing done through your provider. This is going to ease some of the pain of people who don't have insurance and need to go to some of the free testing sites. Let's take a look at the data dashboard. As of yesterday, We have cumulative cases of COVID-19 in the county, 9,731, 122 new cases, 190 deaths, 3 new deaths. Certainly our thoughts are with the families who have lost loved ones due to COVID-19. And you can see there our hospitalization rate, we're up to 177. Only a few months ago, we were down to about 52.
Yeah.
So I know a lot of people have questions about that, but you know, if we just slow the spread, the hospitalization rate will go down. You know, there's no escaping this virus.
No.
I've said it many times before on this program. We have to follow the social distancing and physical distancing guidelines, as well as frequently washing our hands, as well as wearing our mask. And I want to say we had our mask on prior to this broadcast, but we do remove them so everyone can properly and clearly understand the information that we are sharing. You know, as we close out, I want to take a look at the watch list here. You know, we had a lot of comments. A lot of people are looking to put blame on Dr. Cody when she's only doing the job of the health officer for a county, as well as saying that the blame is on other things. But we all have to do our part, you know. And some people were saying, well, the county is being too strict, so I'm going to go to Santa Cruz to go to the gym. Or the county is being too strict, I'm going to go to San Mateo to get my hair done. But I want to let you know that the state has put all of these counties on a watch list. Our county has been on it a little bit longer than some of the other counties, but they have since been added. This week alone, Santa Cruz was added to the watch list, and San Mateo was added a few days ago, so everyone is under the same restrictions as Santa Clara County. So we just have to do our part to slow the spread of the virus.
Yeah, absolutely. And we provide a lot of guidance on our website as well too for these businesses to be able to operate outdoors. We understand that a lot of personal care services are, you know, feeling the pain of this disease right now. But I mean, thankfully the state as well as us, our county as well, have provided that guidance for them to modify their business to the best of their ability. So please reach out to them. Don't assume they're closed. Just reach out and see how they're operating at this time too.
Yeah, I went to get some food the other day, and I pulled up to the, well, it's the vegetarian house. And the parking lot was empty, and I was like, it's closed. I was almost about to turn around and leave.
Yeah.
But somebody came to the window. So yeah, support those local businesses. Yeah. Everyone's having a very difficult time right now in all of the counties, and the way we can help them is by doing our part to slow the spread. All right, well, that's going to do it for this edition of Live with the County of Santa Clara. Thanks for joining us. Have a great weekend, everybody, and be safe.